In this module, we're going to take a look at health and aging, and especially health and aging in the United States. So first, it's fair to talk about, well, what is the sociology of health? How would a sociologist define health? For us, health is very relative. Just like deviance was relative, so is health. It can be very subjective and really could pertain to a number of areas. In sociology, we first of all look at social health. Do you have connections to others in a social interaction kind of way? If you remember early on in the course, we talked about social development, and not being exposed to others can have a real stifling effect on one's overall development to a functioning human adult. Physical health, maybe your medical health. How is your physical body? Do you have ailments? Have you had broken bones? Those sorts of things that can all factor into health. And finally, your psychological health or mental well-being. How well do you feel included into groups? Do you have moments of depression, anxiety? Some of those are very normal and natural things that many of us face at many times. So all of this factors into kind of a very not easy to describe view of, well, what is health? Health is very much, as many people describe it to be, what they make of it, right? Some people feel very, very healthy but may have certain disease, or others may feel really, really depressed but be physically healthy. So it can be very relative. A great notion out of the textbook that I think is very interesting is what we call the sick role. Talcott Parsons came up with this, and the sick role is really, in order to maintain equilibrium in society, we must have a way to cope with illness so as to not have it spread. If you think about, we need to put measures in place so that people want to get better. If everybody was just sick in society, we would potentially have a situation of a lack of economic stability. We might even have political instability if people were constantly ill in the government. So there's a lot of ways in which the sick role comes to play an important role. What is the sick role? This is simply a set of shared cultural norms that legitimates deviant behavior caused by illness and channels the individual into the healthcare system. Well, what does all that mean? Well, it means you sometimes have to do things that you normally wouldn't do. They're considered deviant, like calling in sick to work, for example, but it's excused in many cases, often because you are ill. And so there's this notion that when you are sick, there's a different role set that you can take on. And in fact, Parsons said there are sick roles that you must take on in order to conform to what society expects of you. So the first portion of this, he said, you must be excused from normal social responsibilities. Your focus should be on getting well. That's why many companies and many cities, in fact, now are instituting sick leave and also looking for ways to send people home. They don't want you there if you're going to be sick, so they take you out. And think about, like, even a party. You might call to your friend and say, look, I can't go to a party. I'm just not feeling well. I don't want to get other people sick. There's this other notion then of I'm not responsible for my own condition. It isn't as though in many cases the sick person is viewed as like they can give themselves a magic pill, make themselves better. It's not always that easy. If they have a common cold, they need to relax and rest and all of those things, but it's not as though they could immediately switch to being better by simply choosing to be better. Another element of the sick role is recognizing that being ill is not desirable and that the sick person wants to get better. So Talcott Parsons said, look, people in society need to have that desire that they want to get better. If everybody just wanted to stay sick, it would not be very productive. And again, a very functionalist way to look at it, right? So the last one is an obligation to seek medical care and cooperate with that advice. So if, for example, you have a cold that's going on for weeks and weeks and weeks, or a cough that others around you are concerned about, there's an expectation in U.S. society, at least, that you go to get care and follow the advice of those care experts so long as they are, in fact, experts. And so that was an interesting way Parsons looked at it very functionally, that when you're sick, we have to come up with these kind of coping mechanisms as a society in order to keep things stable. Talking about health in the US, there's a lot of factors of life expectancy, and we talked about life expectancy earlier on, but some of the things include biology. How are you genetically programmed to be the human you are? Do you have predispositions to certain genetic diseases? Race plays a large factor. We often find that race and ethnic minorities will sometimes have lower life expectancies simply based on a number of other spurious factors. So maybe they live in an impoverished neighborhood where healthcare is a challenge to get. Social class also speaks to that. Living in an area where the neighborhood is very, very poor or impoverished or doesn't have all the resources of a really well-to-do hospital or trauma center. There's occupational factors also. Having a job in an office is a lot different than having a job on a construction site. Those will carry with it different risk factors simply based on where you go to work every day. Marital status. We often actually find that married people do live longer. There's a number of factors for this, one of which is that there's a nagging factor, right? So if you go home and your spouse is nagging you, hey, you really are sick, you still should go to the doctor, that actually prompts people to go to the doctor more. And the same is found true when you have a domestic partnership or any long-term relationship where you're actually living and cohabiting with one another and can encourage the other person to go seek out medical care. Kind of having that check of somebody else saying, look, do I look sick enough that I should go to a doctor? And having them say, oh, you better go. Also, just general at-risk behaviors. Do you go motocross riding every weekend? That's going to decrease your overall life expectancy simply based on the nature that there could be accidents, you're doing more damage potentially to your body, and just overall risk. So all of those are factors in how long you might live and overall health. Overall, we find that Asian Americans actually, and the book talks about this, have the best overall health profile, at least in the US currently, and that women tend to live longer than men. And this goes for a number of risk factors. Typically, women are actually less risky in terms of doing things like going out motocross riding and those more high risk behaviors. Also, especially as boys develop versus girls develop, we socialize girls often more towards nurturing and domestic things. And again, this isn't to say it's right or wrong, but versus boys being much more adventurous, go outdoors, play hockey, those things. And women also now are catching up to men, but it used to be that when women were not in executive roles and those things, they didn't have the same heart attacks and stress factors that men did. But now with women's equal participation in the workforce, we don't find this to be such an issue anymore. There's also the notion that is very true that the poor don't have equal access to the healthcare resources. And that often compounds them at a disadvantage where many times you need an ID card or other address in order to get general ongoing care. Now, certainly anybody can go into an emergency room, and that's in a true emergency, but it's that ongoing general seeing a doctor when you just need a doctor that is an emergency level. And not having that can put you at a real disadvantage to catch a number of diseases and other things that could be very much managed and not become a life-threatening issue. So one of the things the book talks about that I actually think is really interesting is women in medicine, and it talks about how female physicians earn less than their male counterparts, typically about 86% to their male counterparts. So, well, why is that? I'm not really, feeling right or wrong about, it, but why? Well, first of all, the average years of experience is lower for women than men. Part of this is actually a very large catch-up, meaning that for the longest time women were not allowed into the highest levels of medicine, they were not allowed to the best colleges, so there's just a societal catch-up also of those folks now graduating in much higher numbers, women being encouraged into math and science majors, but that wasn't the case even up until the 70s and 80s, and so that catch-up will take some time. Another factor is that women do fewer hours. And now, doctors are not usually paid by the hour, but are paid by the number of patients seen. And women are typically seeing fewer patients than men. And a lot of times this is for childcare. Women still come out as the primary caretaker in the family. And they also found that female doctors are spending more time with their patients, so therefore they can see less of them in a day. Finally, another factor of this was looking at the type of practice. Women were much more likely to be employed by an HMO system versus owning their own private practice or being a partner in a practice. And finally, women were also concentrated in lower paying specialties such as internal medicine, the family, and pediatric practices. So one of the other pieces of this chapter is really looking at aging or the graying of America. We know people are living to be much longer. Well, why is that? Well, overall, lower fertility rates globally and in the U.S. As you see here, people back as even in 1971 were bearing about 5 children on average globally, not necessarily just in the U.S., globally. And by 2010, that number had dropped to 2.5, almost cut in half. So there's a number of factors here that have to do with contraception, but also it has to do with the fact that women are also choosing not to have as many children simply because they are entering the workforce themselves. Maybe they're going and spending more time in college and pursuing their career before they have children. All of those factors are coming into a lower fertility rate overall, which is making a little bit older population versus a younger population. There's also this factor that baby boomers made up a huge portion of the population. Those were all the folks born from 46 to 64, roughly after post-World War II. So people had gone off to the war, they had come back, wanted to start a family. Many people were having children. Well, that dropped off. By 1965, you had Generation X, and that goes up until 1980. They were having a lot less kids. Their parents were the baby boomers, and they decided that they weren't going to follow their parents, and they might have one or two children, or no children at all, also. And now we have Generation Y, or the millennials. That's those of you born in 1980s, the 1990s. And in this generation, we're finding that there's a lot of really great things going on in terms of social focus and looking for work in the nonprofits and this very altruistic view and being very socially minded and socially conscious. And at the same time, we're also still finding the Generation Y, much like Generation X, is not having the same number of children that their grandparents at this point would be having, the baby boomers. So it's a lot less kids overall, which means the population at the younger ages is shrinking, but you still have this large growing baby boomer and soon to be Gen X population that will be graying and getting older. So again, thank you so much, and I just want to continue to remind you to go out and be curious about the world, ask questions, use your sociological imagination to explore the world and make sense out of it.